Welcome back. A Lebanon County man was on vacation when he suddenly had blood in his urine. Dave Bishop didn't know what was happening, but he knew he needed to see a doctor immediately. Here's Dave's journey. Dave Bishop and his wife Sue take advantage of this beautiful day. They spend the afternoon on the tennis courts.
Good shot. Another good one.
After a few games, Dave must get to work. It's his job to clean off the courts as an employee of the Hershey Country Club.
Good exercise, for one thing. The camaraderie with people, I enjoy being with the people there. And I'm still competitive, so I enjoy the competition. It's a good workout. You play it, even doubles is a good workout.
An active lifestyle that was interrupted while they were in Florida playing tennis.
We were on vacation and suddenly I have blood in my urine, and a significant amount.
I called my sister, who was a nurse, and she said, "Does he have pain?" And I said, "No." And she said, "Go to the ER."
The ER doctor said, "Well, it might be a urinary tract infection. However, I think you ought to see your doctor when you get home." Being scared right off the bat, we decided we're going to take off right away. And we drove all the way home in one shot from Florida, and then got an appointment with the family doctor.
Our family doctor sent him for some tests, and then he sent them right away to the urologist.
So we went to the urologist and discovered that we had bladder cancer.
Bladder cancer is a cancer that starts in the lining of the urinary bladder. It can also affect the lining of the kidneys and the ureters, the tubes that drain the kidneys.
At that point, you're wondering, well, what's that mean? Am I going to live or am I going to die from this? Cancer word was, something that you thought, that's a death sentence.
It was very difficult, very scary, and very stressful.
How do we go about telling the children and the grandchildren, and how are we going to deal with this?
Dave's urologist suggested BCG to treat the cancer.
BCG is a weakened form of tuberculosis that we use in patients that have non-muscle invasive bladder cancer to try to prevent them from having recurrences within their bladder, and also to try to keep them from having progression to muscle invasion.
Dave underwent BCG treatments for a number of years until the therapy stopped working.
At the point where we first met him, he actually had some disease that had grown into the ureter itself, into the tube that drains that left kidney. All of these are signs of progressing disease and signs that we're no longer really able to treat the patient with the bladder intact.
Quite candidly, he said, well, I think you've come at the right time. I think you just dodged a bullet. It's time for us to remove your bladder.
So what I recommended for Dave was that we remove his bladder and his prostate along with the lymph nodes in his pelvis, which would be the first place that the cancer would spread to. We also wanted to take out his left kidney, which was no longer functioning, and the drainage tube that led from the kidney down to the bladder, which had cancer in it. In order to reconstruct his urinary tract, we would take a small piece of his small intestine, connect his remaining ureter to the one end, and bring the other end out to the skin. He would wear a bag over that opening. The urine would drain continuously into that bag.
He said, this is going to be necessary, and here's the way you're going to deal with that from here on out. You're going to have a stoma, and you're going to have a bag for the urine, and you'll empty it that way, and this is the way you'll be.
My question at that time, I remember that, is that going to get rid of the cancer? And he said, yes. And we looked at each other and said, do it.
You're apprehensive and yet wondering, is this is going to be the solution? So you go through it.
Day of surgery, I think it was like an 8-hour surgery. So that was very difficult. We had friends and family, everybody came in and was sitting with us. And Dr. Kaeg is wonderful when they get through a certain stage and he comes out, talks to the family, said everything's going fine.
Dave spent a few days in the hospital and a few months getting comfortable with the ostomy bag.
It's an adjustment, and we would have very good ostomy nurses from the med center would help out and say, well, here's how you can do it.
We had to learn how to clean the bag, how to take care of everything.
A new and much better way of life for Dave and Sue.
I'm feeling probably 100% of what I had been prior to this time. And I feel good to be on the court now.
He had his surgery. He has something that he has to live with for the rest of his life, but he's going to live, and that's the important thing.
I am a survivor, and that's the most important thing to me, that when you start talking about cancer, also that tag of survivor is, to me, the most important thing.
Dave is chairman of the Bladder Cancer Support Group at the Med Center. He wants bladder cancer patients to realize you can do almost anything after the surgery, as you could well see.